Hello and welcome. Today, we're going to dive into a pretty incredible story. It's about the scientific journey of fighting a rare cancer called Waldenstrom Macroglobulinemia, and it's a perfect example of how we've moved from just treating symptoms to designing incredibly smart, targeted medicines. So let's start with a big question. What if you could find the one thing that keeps a cancer cell alive and just flip a switch to turn it off? It sounds a little like science fiction, right? But that single idea is exactly what's behind this whole new world of targeted therapy. It's about fighting smarter, not just harder. Okay, so to really get what makes these new treatments so special, we have to start at the beginning. We need to understand what this disease is and how we went from just giving it a name to actually cracking its genetic code. So what exactly is Waldenstrom's? Well, you'll often hear it called WM for short. It's an uncommon and usually slow-growing cancer that starts in your white blood cells, specifically a type of cell called a B cell, which is a key part of your immune system. Now, here's where the story gets really interesting. The huge breakthrough came when scientists found a common link. In more than 90% of people with Waldenstrom's, their cancer cells all share the exact same genetic typo, a mutation in a gene called MYD88. All of a sudden, this wasn't just a random disease. It had a target. Just look at this timeline. It tells the whole story. Dr. Waldenstrom first described this thing way back in 1944. But then, look what happens in 2012. Boom. The pace just explodes. That's the year researchers found a single, specific gene mutation. It was the ultimate aha moment that opened up a brand new playbook for fighting WM. Finding that genetic flaw was like finding the key to the cancer's engine room. For the first time, researchers could ask a totally new question. If we know what makes the engine run, can we design something to shut it down? So how does this cancer engine actually work? Well, that faulty MYD88 gene is like a gas pedal that's stuck to the floor. It's just constantly screaming, grow. That signal travels down a pathway, and one of the most important stops along the way is a protein called BTK. Once BTK gets that signal, it's the final green light that tells the cancer cell, yup, keep dividing, keep surviving. And that leads to a really simple but brilliant idea. If you can jam up that BTK protein, you can cut the signal. You can stop the cancer. And that is exactly what a class of drugs called BTK inhibitors do. They're designed to find that BTK protein and block it. The growth signal gets cut off, and the cancer cells, well, they just can't survive without it. The very first of these drugs to be approved was called Ibrutinib, and it was a total game changer back in 2015. I mean, for the first time, there was a really effective treatment that wasn't chemo. But there was a catch. Ibrutinib wasn't super precise. It had what scientists call off-target effects. And these off-target effects weren't minor. The drug was hitting the right target, BTK, but it was also hitting other things in the body it wasn't supposed to. This led to some really tough side effects for patients, things like high blood pressure, irregular heartbeats, bleeding issues, and more. It worked, for sure, but it often came at a cost to a patient's quality of life. So that problem became the next big challenge. Scientists knew they were onto something huge, but they asked, can we do better? Can we design a drug that keeps all the cancer-fighting power, but gets rid of all those collateral damage side effects? And they did it. They went back to the lab and custom-designed a new second-generation drug called Zanubrutinib. The entire goal was to make it way more specific, to have it lock on to the BTK protein and pretty much ignore everything else. I think this is the best way to picture it. Think of the first drug, Ibrutinib, as a master key. It can open the right door, the BTK lock, but it can also jiggle open a bunch of other doors it's not meant for, and that's what causes the side effects. Zanubrutinib, on the other hand, was engineered to be a precision key. It's designed to fit perfectly into that one BTK lock and just leave all the other doors alone. So you've got the original drug and the new, supposedly smarter version. But is it actually better for people? You have to prove it. And to do that, researchers set up a head-to-head showdown, a huge clinical study called the Aspen trial. And this was a really big deal. The ASPN trial was the first time ever that these two drugs were directly compared against each other in patients with Waldenstrom's. One group got Ibrutinib, the other got Zanubrutinib. This was going to give us a definitive answer about which one was better. And the results on the safety front were wow. Just look at this. This chart shows the risk of atrial fibrillation, that serious heart side effect we talked about. With ibrutinib, 15% of patients experienced it. With zanubrutinib, that number dropped all the way down to just 2%. That is a massive life-changing difference. And it wasn't just the heart issues. You saw this same story play out across many of the most common side effects. Less hypertension, less major bleeding, less diarrhea. That precision key was clearly doing its job, making the treatment much easier for patients to tolerate. Now, in the spirit of a full and honest picture, there was one thing that was higher with zanubrutinib, and that was something called neutropenia, which is a low white blood cell count. But, and this is a really important but, the study also found that this didn't actually lead to patients getting more infections, which is the main concern with low white counts. Okay, so we've established it's safer, but does it work as well? The amazing answer was that it seemed to work even better. This chart looks at the percentage of patients who got what's called a very deep response, basically a really strong hit against the cancer. With zanubrutinib, more than 36% of patients hit that mark, compared to about 25% for ibrutinib. And this is maybe the most important part for patients today. It turns out some people have other genetic mutations, little typos like in genes called CXCR4 or TP53, that can make the WM tougher to treat. And the data from the trial was super clear. For patients with those specific mutations, the older drug just didn't work as well. But with zanubrutinib, those patients did great. This, right here, is what precision medicine is all about. So when you put it all together, the final conclusion from the ASPEN trial was crystal clear. The newer drug, zanubrutinib, was not only safer and easier to take long-term, but it also led to deeper, more lasting responses against the cancer. It was a home run. But you know what? Science never really stops. This amazing leap from the master key to the precision key isn't the end of the story, not even close. It's really just setting the stage for the next wave of innovation. When we look at what's being studied right now, the future is just packed with promise. Researchers are testing smart combinations of targeted drugs. They're developing entirely new approaches, like BTK degraders, which don't just block the protein, but actually get rid of it. And they're looking at really cutting-edge immunotherapies like CAR T cells. And the ultimate goal of all this research? It's to completely change what it means to live with a cancer like this. The dream is to get away from taking a pill every day for the rest of your life. The hope is to use powerful, chemotherapy-free treatments for a set period of time to get a remission that's so deep and so durable, you can actually stop treatment. And that leaves us with one final, very hopeful thought. The progress from that first-generation drug to the much better second-generation one happened in less than 10 years. So with treatments getting this smart, this targeted, just imagine what managing a chronic cancer will look like a decade from now. The pace of change is just incredible. Thanks so much for tuning in.